Hello everyone, myself Anusha Deshpande, Department of Pharmacy Practice, Kelly College of Pharmacy, Belagavi. Today I am going to talk about diabetic neuropathy. So the learning objectives are, by the end of the topic, learners will be able to know the definition of diabetic neuropathy, the symptoms of diabetic neuropathy, and they'll also read the management of disease with a case study. So we'll see what is the definition of diabetes mellitus, types, and what is the management of diabetes mellitus. So as we know, diabetes mellitus is one of the most common disease which we see in our India, and it is an endocrine disease which is characterized by decrease in insulin or complete stop of insulin production in our body. It is all because of the beta cells in the pancreas are damaged. Due to this, there is hyperglycemia seen in the patient, which leads to many complications. So there are main two types of diabetes mellitus, that is type 1 and type 2. Type 1 is insulin dependent diabetes mellitus and type 2 is non-insulin dependent diabetes mellitus. The third main type of diabetes mellitus is gestational diabetes mellitus, where the woman who is pregnant has diabetes mellitus. The main symptoms of diabetes mellitus is increased thirst, frequent urination, unexplained weight loss, and extreme hunger. Once the uncontrolled diabetes mellitus is seen in the patient, they get many complications like they have diabetic neuropathy, nephropathy, retinopathy, diabetic foot, and many other cardiovascular diseases. And the main prevention or preventive measure what we can do for diabetes mellitus is change our lifestyle. Proper diet, proper exercise, proper maintenance of the body weight, which helps in the control of the weight of the person. And the last thing is the treatment option. They give insulin therapy, oral anti-diabetic drugs are given for the patient, and with this, regular checkup of blood sugar level in the body is also done. So let's come to our topic, that is diabetic neuropathy. Diabetic neuropathy is a serious and most common complication of type 1 and type 2 diabetes mellitus. It is a type of nerve damage which is caused because of the high blood sugar level which is seen in the patient. Longer time the blood sugar level will be very high. The condition usually develops very slowly and sometimes over the course of several decades. Like it takes around 7 years, 8 years, or even 10 years for this neuropathy in the body of the patient. What are the symptoms of diabetic neuropathy? The patient is having sensitivity to the touch, loss of sense of touch, difficulty with coordination when walking, numbness or pain in the hands or feet, burning sensation in feet especially during the night time, muscle weakness, blotting, nausea, indigestion or vomiting is also seen in the patient, diarrhea or constipation, excessive or decreased sweating, bladder problems such as incomplete bladder emptying, vaginal dryness, erectile dysfunction, inability to sense low blood glucose level or hypoglycemia, diplopia, increased heart rate, and dizziness. So let's come to the SOAP analysis of a case study, that is subjective, objective, assessment and planning of a case study. So this is a case of 53 years old male who was admitted in the general medicine with a chief complaint of or subjective evidence, that is symptoms of the disease. So the person or the patient had complaints of tingling sensation for his both the legs, pin and needle sensation in both lower foot, and also the person had dyspepsia. So all the above complaints were since 2 months. The objective evidence, that is the investigation which was done on the patient, the past medical history, the patient was already having diabetes mellitus since 4 years and he was on medication, that is tablet glycomet 500 mg, that is metformin, used to take in the mornings. OD was given to the patient. Personal history, the patient was vegetarian but he had habit of chewing tobacco since 20 years. The sleep was disturbed in the patient and bowel and bladder was normal and regular. Next, the physical examination which was done on the patient was BP was monitored. It was normal, that is 110 by 80 mmHg. Pulse rate was 68. It was also normal, 68 beats per minute. Temperature was also normal to the patient. The systemic examination once which was done on the patient, everything was normal. And the main thing, that is biochemistry reports. The abnormalities was seen, that is ESR was high, that is 20, platelets were high, and the main biomarkers of diabetes mellitus, that is HbA1c, was also high. The less than 5.6 is normal, the patient is normal. Between 5.7 to 6.4, the patient is pre-diabetic or diagnosed as pre-diabetic. And once the HbA1c is more than 6.5, then the patient is said to be diabetic. So here the patient was already having diabetes since 4 years, and patient was not adhered to the medication, and irregular physical exercise was also there. So the HbA1c of the patient was 7.6. So he was diabetic. So the provisional diagnosis by systemic and subjective and objective evidence, the provisional diagnosis was done is diabetic neuropathy. Assessment is nothing but how we are going to diagnose the patient by using the subjective and objective evidence. So subjective evidence, that is the person had tingling sensation. So it is one of the main symptom of diabetic neuropathy. So by subjective evidence, it says the patient is having diabetic neuropathy. Objective evidence, the HbA1c is high in the patient, and also the patient is having history of diabetes mellitus since 4 years, and he was on medication. So the HbA1c is also a main objective evidence for the diagnosis of the patient. Next, the ESR. ESR is increased in the patient. It is due to the nerve damage which is seen because of the increase in blood sugar level. So the final diagnosis which was done for the patient was type 2 diabetes mellitus with neuropathy. So the planning, the goals of the therapy is to regulate the sugar level in the patient, as it is one of the most important thing to do in any patient, in any diabetic patient. So how we have to regulate the sugar level? By educating them about the treatment which is given to the patient, and by educating or telling the importance of medication adherence in the diabetes mellitus. If they take the medication, the sugar level will be maintained. So this thing should be told to the patient. Next thing is, the pharmacist has to educate about the complications of diabetes mellitus. So we have 5 different complications. So for further complications which should not be seen, so the doctor has recommended or referred the patient for the ophthalmology, and the doctors has advised him for the glycemic control, and yearly the patient has to check their eye frequently. And for as a patient has dyspepsia, so for that symptomatic relief was given by giving the particular treatment. Next, to check the blood sugar level, and if necessary, if the blood sugar level will not come into normals, then insulin is also given to the patient in order to control the sugar level. So the main important investigation what we do in the diabetes is checking the blood sugar level of the patient. So at the time of admission, the blood sugar level was high, and at the time of discharge, the blood sugar level was in the normals. So it is all because of the correct treatment which was given to the patient during the admission. The therapy which was given to the patient was methylcobalamin, normal saline, ranitidine. Injection ranitidine was given for 2 days in order to decrease the patient's symptoms of dyspepsia. Alprazolam was given because the patient's sleep was disturbed. Then from injection methylcobalamin, it was changed to tablet for neuropathic disorder. Tablet ranitidine, from injection it was changed to tablet. Then glycomet was given, that is metformin, twice a day, as the patient had history of taking medication history, metformin once a day. So during the admission in the hospital, they had asked the patient to take in the morning and in the night in order to control the glycemic control in the patient. The discharge medication which was given to the patient was methylcobalamin in order to protect the nerve damage. Tablet ranitidine 150 mg was also given to the patient, and glycomet once daily in the morning was prescribed for the patient in order to control the glycemic. So the follow-up, the patient was asked for the follow-up after 15 days to the outpatient department. So the patient education plays very important role in the prognosis of the patient. So we need to educate about the drugs, about the disease and about lifestyle modification. So the patient was educated on a tablet Rantac, that is ranitidine. We have to take before food, and about glycomet GP we have to take early in the morning before breakfast once daily, and patient was also educated about the hypoglycemia which is caused during the day. So what are the precautionary measure, what we have to do once the patient gets hypoglycemia? So everything was educated to the patient. And about the disease and about lifestyle modification, about adherence we need to educate. So the patient has to not skip their oral anti-diabetic drug in order to shoot up their glucose level in the body, which leads to further complication. As diabetic foot is one of the main complication in uncontrolled diabetes patient, so we need to educate the patient to wear proper socks or proper footwear to prevent from getting wounds, which leads to gangrene further. As patient was already eating tobacco or having the habit of eating tobacco, the patient was educated about worsening of the condition if he continues eating the tobacco in the future. The patient was also educated about the physical exercise or about yoga or walking, so that he can do daily in order to maintain the blood sugar level in his body. And also patient was educated about the hypoglycemia, what are the precautionary measures to be taken, what are the symptoms of hypoglycemia, and what treatment the patient can take himself in order to prevent further complications. So these are the references which I used. Thank you.